I want to get on to this next story because, well, Aaron Derfel does great work as the health reporter at the Montreal Gazette. He's come up with some stories that, basically were groundbreaking. And this is another one. I don't want to call this groundbreaking. It's tragic in the sense that it's still happening. We thought these things might be under control. His new report suggests, this is as of yesterday, there are now five Montreal hospital emergency rooms at over not 100, 200% capacity. Aaron Derfel is on the line. Aaron, thank you for coming on.
Good afternoon, Aaron.
Look, we know the situation is dire. We also know this time of the year is particularly worse. I don't think we ever expected to basically get to a point where 5 hospitals are now at over 200% capacity. So number one, where do we go from here? How did this happen? And have you heard anything from the government on this?
So the government is saying that is downplaying this, saying that this is typical of the flu season, which is now beginning to ramp up. But when you dig a little bit deeper, you realize that there are other problems. COVID is resurging, so there are 1,758 people with COVID, in the hospital. It doesn't mean they're all very, very ill, but 52 of them are in intensive care. So that's high. It's like the highest it's been since last January. Plus, you have the flu season. There's, we've had this burnout among nurses. And I was also told that the strike, as you recall, there were these strikes a number of days ago, and they might occur again in December. That's slowing things down, slowing down the patient flow. So all these things are adding up, and there's an accumulative effect. And that's why yesterday, something I hadn't seen in the longest time, I don't think I've seen it before, where 5 city ERs were above 200%. Today, it's a little bit better, but right now, as we speak, at Royal Victoria Hospital, at the Glen site in NDG, the occupancy rate is 233%, and the average wait on a stretcher in the hallway is 53 hours and 9 minutes.
Oh, my God.
That's crazy. That is crazy. And I saw that you posted that they put a little notice up saying that we're missing 5 nurses right now. So obviously there's a staff shortage, but that's not due to the strike. They're maintaining essential services, right?
Yes, but so ER workers who are the hardest hit, who can't go on strike because of the requirement to provide essential services. But the other wards, they can go on strike. So the ERs can use, normally they could use the wards to decompress to transfer patients. But because there's been this slowdown, they can't decompress. So I don't know which one thing it is, but it's to me, there's something odd about this, and sadly something worrisome, because we're not in January. It's the end of November, and it's just bad.
I'm looking down the list here. I want to point out, we said 5 hospitals. It's the Royal Vic, LaSalle, Lakeshore, the Montreal General, and the Montreal Children's, right?
And things were supposed to get better.
Exactly. How we knew this might happen in one particular hospital, maybe for a little bit, to see all of them at this level. I mean, it's mind-boggling in a sense.
Well, yeah, and that's why you'll recall it was around this time last year that the Health Minister, Christian Dubé, he set up a cellule de crise, a crisis cell, to reduce ER overcrowding, and we haven't heard from it. And André Fortin, who's the Liberal health critic, he told me this afternoon that basically that crisis cell is dormant, and there's really been no improvement.
So
I was just going to ask, I would ask you, what do you tell people who have to go to the ER other than don't go to the ER if you absolutely don't have to? We always wonder, people show up, and we've been told this so many times, Natasha, right? I mean, try to get seen somewhere else, go to one of the clinics if you can. I would think now is the time to repeat that message again. The last thing I can't believe what you just said. The average wait time on a stretcher in ER is what?
55 hours and 9 minutes at
That's
the Royal
insane.
Vic. And it's not much, like at LaSalle Hospital, it's 44 hours and 8 minutes. And what your listeners should understand is that this ER overcrowding, ideally, there should be some buffer room. It should be an occupancy rate of maybe it's maybe 79, 80%. To have that, and at 130, it's problematic. But when it's 233% at the Royal Vic, and at the US General right now it's 240%. Then the risk of medical errors and accidents goes up. Then it's no longer just an issue of having to wait really, really long. Everyone's under increasing pressure, and complications can arise. It becomes a serious issue.
Serious indeed. And again, I'm not sure how this gets handled. The government obviously is aware of these numbers. They are now that you've brought them to light. Let's see if this situation gets better over the next couple of days. Aaron, as always, great job on the reporting, and thanks so much for being with us.
Thank you.
My pleasure.